I'm Arwel Jones. I'm a research fellow at Monash University. So the health challenges we're trying to solve with this research was severe flare-ups of lung conditions. People living with asthma, bronchiectasis, COPD or interstitial lung disease will often get hospitalised because of severe flare-ups of their respiratory symptoms. These flare-ups often occur following respiratory viral infections such as the common cold and the flu. During the COVID-19 pandemic, there's been numerous reports worldwide of a reduction in the number of these flare-ups. The researchers suggest that this is due to the introduction of various public health measures in response to the COVID-19 pandemic. We wanted to understand if the reduction in those flare-ups were due to the adoption of public health measures and whether people with lung conditions will continue with those through the pandemic. We surveyed 193 people online. People took part across all states and territories in Australia. People who took part were living with asthma, bronchiectasis, COPD or interstitial lung disease. We asked them, after most of the population had been vaccinated for COVID-19, would they continue to use public health measures and would they encourage all people to continue with health measures during the flu season, or perhaps should everyone follow those health measures at all times? So people living with lung conditions in Australia are supportive of physical distancing indoors and hand hygiene to avoid flare-ups of their lung conditions. There was no widespread support for adoption of face masks across all indoor and outdoor settings. There was support for face masks during the flu season on public transport. This tells us, as researchers, but also as doctors and nurses and healthcare professionals, what people with lung conditions are going to continue doing following the COVID-19 pandemic. It can also guide us as researchers on what we need to do next to help understand the impact of public health measures on flare-ups in people with chronic lung disease.